이어서 잉글리시 뉴스가 방송됩니다.
제주의 꿈 함께 만들어 가요. KCTV 제주방송.
Welcome back to KCTV English News. I'm Hee-jung Lee. The identities of 5 dead bodies that were found at a runway at the Jeju International Airport were confirmed after 74 years. The dead bodies are assumed to be victims from the April 3rd incident. The provincial government and the Jeju April 3rd Peace Foundation said that after conducting a new DNA and blood collection test from bereaved families, they could identify the identities of 3 victims from military trials and 2 missing people. They had recovered remains from 2007 to 2009 at the Jeju International Airport, but the identities were not confirmed. Meanwhile, additional 6 remains were recovered after an excavation investigation at 7 locations where dead bodies are expected to be buried, including Kashiri in Seogwipo City last year. The province plans to begin identity confirmation through DNA tests. As the Omicron mutant virus quickly spread during the Lunar New Year holiday, epidemiological investigation by quarantine authorities has reached its limit. Accordingly, beginning today, people with confirmed infection should report their own movement route, and medical clinics have been allowed to conduct rapid antigen testing since last Thursday. Mike Laidman has the report.
This ENT clinic in Jeju City has created an area to conduct rapid antigen tests for COVID-19. Under the rules of the new national COVID-19 response system, the more reliable polymerase chain reaction, or PCR tests, are now reserved for people aged 60 or over and those who have come into close contact with a confirmed COVID-19 patient. Also now allows medical clinics to conduct rapid antigen testing. Previously, Jungang Hospital and Hanmaum Hospital were the 2 nationally designated testing and treatment facilities for the coronavirus in Jeju. Now, 25 local clinics have joined the testing and treatment facility list. Patients with a fever and/or respiratory symptoms can get tested for the virus and even get a prescription from the newly approved clinics starting today. But some clinics that were appointed are expressing their dissatisfaction at a decision that was made outside their control. The clinics must have separate areas for patients with COVID-19 symptoms and those without, but this can be difficult because of the space required. The shortage in certain medical supplies, such as protective clothing for clinic staff, has also been pointed out as a problem.
방호복 등의 간편한 방역 물품을 좀 지원해서 병의원에서 안심하고 코로나 검사를 할 수 있는 여건을 만들어줬으면 하는 바람이 있습니다.
With the contact tracing abilities of quarantine authorities having reached their limits, tracing methods are changing from today in order to focus on higher risk groups. When a case is confirmed, the public health center will send a text message to the infected person. This patient must then report their movements and also a list of people with whom they have had recent contact. As Omicron cases continue to grow rapidly, this new system of clinic testing and personal tracing will soon be put to the test. With no more quarantine personnel or resources available, the next few weeks will be very telling in how the virus develops on Jeju. Mike Laidman, KCTV.
Thank you for watching KCTV English News. Have a great evening.